Post-transplant Cyclo revolutionized anti-GvHD prophylaxis, and I would say revolutionary transplantation biology by knocking down alloreactive T cells, upregulating T regulatory cells. And it was pioneered in haploidentical transplant in AML, but then moved to other disease categories and also to unrelated transplantation and sibling transplant. So for the haploidentical transplant, including in ALL, post-transplant Cyclo was beneficial. We published it, I guess, 2 years ago, with better leukemia-free survival, overall survival, and GRFS with post-transplant Cyclo compared to ATG. This was haploidentical transplant. For unrelated, this is under most of the work there is under clinical studies. It's not a common practice, but it seems that post-transplant Cyclo drastically reduce transplant-related mortality, and it's maybe reducing chronic GvHD, and not acute GvHD, but in our hands, chronic GvHD. And it's, in the end of the day, it's beneficial. So I would say that I would go for post-transplant Cyclo in the unrelated setting. Of course, all the field is waiting the 2-arm studies in order to define this issue. But it looks like the post-transplant Cyclo will be beneficial also in unrelated. In sibling transplantation is a different story. We have shown that in AML, at least in sibling transplant, there is no advantage of post-transplant Cyclo compared to ATG. And just now in the presidential symposium of the EBMT, Professor Sebastian Giebel, which is the head of the ALL subcommittee in the Acute Leukemia Working Party, presented work in which he compared post-transplant Cyclo to ATG in patients with ALL and showed that although there was less chronic GvHD with ATG, post-transplant Cyclo improved the leukemia-free survival, but not the overall survival. So I would say that I don't see a major difference in post-transplant Cyclo beneficial for AML or ALL. Again, it's revolutionized the field in haploidentical transplant and made it possible after the work of the Baltimore group, Leo Luznik and Ephraim Fuches. In unrelated, I would say that I will go for it, but it's still under clinical trials. And in sibling, I would say that we should be very careful before using post-transplant Cyclo in the sibling. Of course, in sibling, not everybody, although the 2-arm study show beneficial effect of ATG for the GvHD in sibling transplantation, not all the centers are using ATG for sibling transplant.